I'm Jennifer Salopek. I'm the founding editor of Wing of Zock. I'm here today with Lori Popejoy from the University of Missouri, who was honored recently in the AAMC's Clinical Care Innovation Challenge. Lori, would you tell me the name of your winning initiative?
Our initiative is leveraging information technology to guide high-touch, high-tech care, and we call it Light Squared.
Light Squared. So tell me about Light Squared.
Light Squared is part of the CMS Innovations Project, and it's a $13 million grant that ultimately was funded to improve care coordination and case management for primary care patients in the community. We're using a combination of high tech, so new innovations through healthcare technology, health information and how we use health information, people who can get us information, health information analysts, care coordinators working with primary care physicians in clinics, over 130 doctors, over 10 clinics, and we are combining all those different component parts to improve care for patients living in the community.
So what specific gaps in care or patient care needs was the initiative designed to address?
We really were aiming to improve population health, which is a very broad concept.
Sure.
And to improve population health, you have to be able to get reasonable information about the state of a patient's health and their health care and what might be required for preventative services, what might be required for complex case management. And so the goal of the program was if we could find a way to effectively deliver information to the healthcare team so that they can take these items and actually action on them, to do something with them, and to begin to work closely with patients to improve their own state of health, to allow them through portals to access their own information, to guide them into better management of their healthcare and better communication with their healthcare team. And a lot of care coordination and case management really centers on the ability of the patient to communicate effectively with the healthcare team and to get help when they need it.
Right.
As we are working with new technologies, as we're working with new programs, and we're finding through the care providers, through the nurse care managers, that perhaps these aren't working correctly, as most things don't, right out of the gate. They have been able to then make some adjustments quickly on the fly so that they are more useful to the nurses, to the physicians, so they can actually see information that they can take action upon. The nurse care managers carry caseloads or panels of around 500 patients apiece, and so they have to be able to organize information easily. And the technology has been very useful in helping them to do that. The nurse care managers in particular work off what we call work lists. Mm-hmm. And so these work lists have will tell them which patients need preventative health care services. They receive emails when patients go to the ER or when they are in the hospital. So they can stay engaged with the acute care team. So you begin to look at the outcomes of reduction of hospitalization, reductions of emergency room use. You want to see better use of the primary health care team and less use of the high-end resources in the hospital. And through these warning systems, the nurses have been able to take action on when patients are actually being hospitalized, find out what happened. What can I do for you? Is there something you need that we haven't been able to get for you? Do you need to come into the clinic? Is there something that we need to be doing differently? Patients will often see their nurse care manager routinely instead of seeing their primary care provider as they're trying to change behavior, manage their hypertension better, manage their diabetes better. It can be fairly intimidating when you have a new chronic illness to figure out what to do.
Did you have any large challenges that you had to overcome in creating and implementing the project?
It's large.
Mm-hmm.
It covers multiple clinics, physicians, care managers. We had to hire a new workforce, 19 new case managers, train them. We used Blackboard actually as our training mechanism so that everybody received the same basic information and then embed them in clinics. So the challenges were huge.
Right.
And I honestly think the challenge of how do you build a team of people. And how does that team learn to work together?
Mm-hmm.
And there's the difference between the implementation team and the design team than the team that's boots on the ground actually doing the work. And every clinic is different, and every physician-nurse partnership is different. So there are a lot of moving parts. Being open and being supportive and helping people find a way to solve the problems, in their individual situations was really important. Being open to the fact that what maybe we would have envisioned just not really working as we thought it was, and then being able to make some rapid adjustments as we need to.
What do you think is the most innovative thing about the project?
Being a nurse, and I think care coordination, case management is so essential to good patient care. We developed a documentation system for the nurse care managers to use, which allowed us to identify how much time they're spending on certain key attributes of care coordination. So using the ARC care coordination model, we developed a documentation system based on the 9 domains identified by ARC. And we were able to tell to a very detailed level where nurse care managers are spending their time. And we will be able to make some judgments about what might have been useful in the outcomes of reducing hospitalizations, ER use. We haven't done those analysis yet, but I'm hopeful that all of this information will actually allow us to make better judgments going forward about where we need to spend our time.
How are you measuring your success?
We are measuring our success through basically the reduction of healthcare services at this point. So we're able to influence, it looks like the trend is influencing reduction of hospitalizations for all cause and rehospitalizations. ER use is a little more difficult to reduce, but we're still working on that. We're also going to be looking at how we improve preventative services, and we haven't done that analysis at this point. Mm-hmm. So are people getting the preventative services done that they need at the appropriate time?
Right.